We're very lucky to have the house in Bergen, Huset Bergen as it's called. And it's a peer-to-peer led, driven, own concept that is put together by the user organizations, supported by the municipality.
It's a meeting place, it's a safe haven, it's a place to get information, a place to get help, it's a place to get clothes, it's a place to get food.
I only use my own experience to help other people.
We pay Huset Bergen to have a night shelter. They do all the work themselves, and they're also actually employing people who have either still have drug issues or are in recovery.
Me as a leader, I lived experience. The whole house is built up that either you are a relative or you are one with the lived experience. I got 55 people in the staff now.
55?
Yes, and we got the same salary. And I think that this makes me no more important than the person who cleaned the floor or making the food or is drifting this place. And we are successful because the owner of the house is their house.
The Huset Bergen is next to us in the city, and we see the results. There is no problem in our area of town. We only see that people are happy.
Huset Bergen offers another perspective in the citizenship where we are met equally on an eye-on-eye level, and we collaborate to make a better society.
The Huset now is basically running itself, of course supported by the community. The experience here in Bergen is that people change. When you give them opportunity, you give them responsibility, and when individual people change, the local society changes a little bit, step by step. And in the end, Bergen as a whole, city as a whole, benefits a lot from it. And Norway as a whole, I think, as well.
What is your potential? What do you think this can lead to?
I hope we can start to bring a change of how people look at drug addicts and the rehabilitation of drug addicts. I hope we can show that people who use drugs can do a full day's job.
Take away down these walls.
Yes.
That, we feel and stigma, you know.
My name is Morten Hvaal. I'm a photographer. I first got involved with Huset when it started here in Bergen. People are letting me get closer and closer, but I've also always made sure they know that I am not interested in the photographs when they look like the stereotypical image that you see in the media and many other places of people who use drugs, because there isn't one. What drug users do in terms of the technicalities of administering drugs does not define them as people. If somebody is unlucky and overdoses, that isn't necessarily representative of who they are. And that is the sort of essence of proper documentary making, is that you're not necessarily, or you're not at all after the extremes. You're after what is representative. So what is representative? Which is basically, who are these people? What are they like? Society doesn't know anything about them, largely because society doesn't want to know. It's uncomfortable. They are outside of our tolerance sort of frame for what we can accept to see and know about. And ignorance is the enemy of all kinds of interaction and all kinds of societies.
So this is the House of Bergen. It's the peer-led, high-tolerance center. Everyone who is employed, who's running this place, has his own experience. He's a drug user. He has drug problems, he or her. Now we're going to meet Marianne.
Hello. Hi. Hi. Welcome.
Thank you.
Yes.
So,
Come in to
could
our
you show us around?
house. Yes, of course I want to. This is like in Norwegian is nothing about me without me. Of course.
Yeah.
Of course, it's like that. So, and this is first floor of Huset Bergen. Downstairs we have the street magazine, Arild Bergen.
Yeah.
Here is the living room. Normally here is filled up with people. We have all the furniture and everything we got here is given to us by the citizen from Bergen.
So this is where you hang around?
Everybody's hanging around. Someone is getting help with the computers. When it's football game, they can watch that. This is where we eat dinner. Yngvar and Ola, they are the bosses on the kitchen. Normally through a day we have like a snit for like around 100 people coming in for each day, yeah? So how much food do you make?
400.
400, exactly. He's the chef.
Hey.
Yes. He's our chef and he's the right hand. So we have this information and trying to keep up everybody here and there and upstairs and like everywhere. So it's all the way it's like feeding them to use clean rings, to use naloxone, to use the puck. After you've been using the needle, you put it in the puck.
Yeah.
Second floor. And we have these nice photos on the walls here. It's taken from Morten Hvaal.
Yeah.
He was a war photographer for 30 years in AP, so international known. So he's the photographer of the house in Bergen as well as Oslo.
Yeah, and what is this kind of a room?
This is another living room, but it's also here where the band is and the music is going on. If we got something people need, they can just take it from here.
Okay,
Yes.
so they can just take it and bring
And
it
go.
home? Yeah.
Yes. We also, of course, have the puck everywhere. So
It's for the needles,
yes, it's for the needles. We're sure that
used needles.
they actually use it.
To return used needles.
Yes. And in here we have clothes. Normally this is filled up with clothes.
Yeah.
And they have made this prøverum. So if you need to try to see if you can look good, you're welcome in here. This is clothes that's coming in from the citizen of Bergen. We have just put it out on Facebook. Hey, we need new clothes for men or for women. And another living room where people is normally here sleeping between injection of the heroin clinic, which is straight behind us.
Okay, so they come to rest here?
Yeah, they're coming to rest here. And we also wash people's clothes, machine, where we wash. And we have one toilet.
The only one?
This is the only toilet we have for the guests. So with 100, you know, it's, and as you can see, don't throw the needle straight in the garbage because think about the stuff. And of course we have these boxes.
Yeah.
Like in every floor. We are not a consumption room, but people need what they need.
Yeah.
Yes.
When you need to use a toilet, you need to use a toilet.
Exactly, exactly. So we also have this Camp Gullfjellet. And Camp Gullfjellet is a project together with the owner of Gullfjellet. It's a mountain. And the thing is to come up there. Don't always looking down or being in the streets, but you can come up there and we want to make honey up there, potatoes and stuff, and you can fish.
Good.
Yeah, so throat actually, mountain throat. To be in the nature and to stay together just to do something else, to get away from all the stress and talk about normal stuff.
Yeah, outside of the city stress.
This is Borghild. She's the one who's taking care of all the wounds. Some of our staff's got some wounds. Sitting here. Here is everything happening. This is the meeting room. This is the chaos room. As you can see, what some citizen brought in for us. And sometimes it's really, really full. Yeah. And people can use this stationary computer and here is like we're trying to keep up with all our project, because we are like educating in the university and high schools and who is going where, when. This is the toilet up here, but it's also the shower. So this is what we have. And this is what, it's functional.
I love this stairs.
This stairs is
Wooden stairs.
It's absolutely, yes, you can kill yourself to go it. It's the fire stairs. If it starts firing, you can choose.
We are wondering about the house. This is peer-led, peer-driven. What does this place mean to you? Could you start, Tom?
Yeah, everything. Some of the people who come here to use this house, it's the only place they have that's social within the drug community, but outside the drug community.
Yeah. So how many people are you here at a normal day?
Sometimes we have 170, 50 something. Normally we are around 110 or something, yeah.
How is your experience with this high tolerance? You don't tell anyone to don't use drugs.
I have told people, now you're looking kind of messed up.
Yeah.
You need to get some sleep. You need to get some food. You need a shower.
But is people lying around here? Is there a lot of trouble? Do you see much of it?
In 3 years, we have had a person who drew a knife on a staff, and we had a person that was going to do harm to Marianne. But that ended in a hug and tears. We have, I think, 2 overdoses in 3 years. But generally, people are respectful of the house. The house is a safe haven. This is a place for everyone. When people take drugs out of the pocket to sell, 90% of the time is the other guests that tell them to put it back in their pockets. Right?
Yeah. The special with the house is the atmosphere. It's so kind. It's so low. There is a low energy. There is no aggression.
I came in and this is a girl I know have been abused quite enough, to say it the least. And she sat down in the living room and she was sleeping. And there was much people around her, but she was sleeping because she was safe. And I think that's the main thing about the house, that people come here, they feel safe. Even young girls, we have very many young girls in the age of 20 to 25, right? And they feel safe here because they know that we will take care of them, right? And then when that kind of person just falls down and sleeps, that tells me we're doing something right.
Why is it so cozy? I never see anything like that. It's just quiet, safe.
Yeah.
Why?
Because they want to protect their house. The people, our guests. It's a room for freedom and space and relaxing, and they don't want to fuck it up.
There's no unjust rules to oppose?
No. And there's no consequences. If you have a rule, you have to have a consequence. I don't like consequences.
Just have to behave?
Yes.
Be nice?
Yes. And that's actually quite easy.
Yeah.
If you are reminded of it, that's what you are supposed to do here. Be nice.
Everywhere you go, you can be a client. You come to a day center and say, thank you for what you created for me. Thank you, I can get food. But here, you get so fast responsibility.
Of
right?
course.
Yeah, so you're considered a resource. You can be a leader, you can be an employee.
Yeah. If you're going to the community center, the hospital, there is always an asymmetry. Yeah. And this not being equal, not being treated for who you are. I'm not better than anyone, and I'm absolutely not want to tell other people how to live their lives.
So no more moralism, huh?
No. No. I never ask anyone, are you using drugs?
No.
Because I don't care.
So you treat people as equal?
Yes, and I don't expect them to ask me either. Why should I? And why should I answer them? And we all have our reasons for why we choose, how we choose things and how we do things. And we all have our reasons, and who am I to tell you?
Are you reaching those people that it's so hard to reach for the professionals?
Yes. With the missing link, you know, I think we are the missing link. We have a guy in the night shelter, and she was nearly blind, and he could have his operation on a hospital, but he couldn't read what was down, so he always missed to come there. So we contact the hospital and give them our number, and I can reach him. I can transport him to hospital.
And it's a really good feeling to go in the bus, sit with other people, and yes, I'm going to work. It's good to say it, I'm going to work.
30 years ago,
Yes.
you were employed somewhere,
Yeah.
and now you're employed here.
Yeah.
What does that mean to you?
Everything. And it's not one day who is the same. Every day is different. Every day is different problems, and always looking for solutions to help other people. It's a delicious experience to look at somebody that you have seen before. They just, in the beginning, they just sit like this, and now they are like this.
We support them with everything they need to support for. We move for them, we find flat and apartments for them, find a home. And we also do individual uppfølging for the one who needs it and wants it. Now we have 5 days open at the Huset Bergen. The night shelter is open every night from 22 to 9 in the morning.
So what do you do when you go outreach? Do you go and meet people? Do you go and pick up drug user equipment from the streets?
Yeah. And delivering out clean syringes and
syringe and needle exchange.
Yes, and naloxone is important. Also up to the level of the citizen level, which is about the neighbours and the business people. And to be a citizen, everybody has to be with us in this flow.
Here we have heroin-assisted treatment. So how long have you been going on with this clinic?
4 years since we started heroin-assisted treatment in Bergen. The success is the medication, definitely. The medication gives us an opportunity to build relationships and go on further with the treatment of addiction.
Because it's a diamorphine.
Yeah, it is. The patients have tried everything for so many years, not succeeding, not feeling well. And now they finally get a medication that gives them what they need. We have patients after injection heroin that looks like me.
Yeah.
I can talk to them as I talk to you now.
They're functioning well.
Absolutely functioning well. We have one patient who describes it fantastic. She says, I can breathe.
Yeah.
Finally I can breathe, and I'm going out for work and do her things. And that's amazing to see. You want to see the injection room?
Yes, thank you.
Yeah, it's in here.
Great. I like it here.
Yeah, it's open, it's bright. We can have several patients here at the same time. This is diamorphine.
Well, is this just harm reduction to keep them alive? Is this treatment that gets them to a better place in life? Is this good for the health? What do you get from heroin-assisted treatment?
Yeah. Better quality of life, definitely.
Better quality of life.
Yeah. What we see here is we don't have all these abscess and infections, they are safe. They know where to get the heroin the next time. And we try to not just give the heroin, but also take care of the rest of the person. They get a better economy. And also people who are changing where they live from the hospice to their own departments.
Yeah.
It's big, big victories. For our patients, it really changes lives, I think.
Yeah, so it saves lives.
It saves lives, definitely. This is Marianne's design. And when Oslo made their HABIB in Oslo, she said, we need something in Bergen. And HABIB in Bergen. And HABIB in Persian means dearest. So we are the dearest. HABIB.
HABIB.
Yeah, and
Yes.
you did design it.
Yes, we designed it. I was so happy.
Yeah.
Yeah. In Denmark, it's called valmuen, which is the poppy.
Yeah.
It was HABIB, and here is HABIB.
Yeah.
My love.
Yeah.
So it was a little bit of an activism in this name.
You are an activist. Oh.
I'm Yngvar. I work as a chef here.
Where were you before you came to the house?
I was mostly on the street. I was selling heroin, using heroin.
Is that long ago? How long have you?
1.5 years ago.
And how did you get to enter the house?
Well, I started here as a volunteer. Then I started to get the heroin from the state.
So you are in the heroin clinic.
Project, yeah. That helped me get off the street, really. So and I started working here, and now I work 100%. And make my own money, and it's all good.
What does that do to you?
Well, I feel like a normal person, I guess. I contribute.
You have a responsibility, right?
Yeah.
You're running the kitchen.
Yeah.
And that's okay?
That's very okay. As long as people are happy, I'm happy. And they are mostly happy.
Marianne has a knack for seeing the possibilities that lies in a person, right? She don't coddle you, but she gives you something to do and she helps you do it. Everybody has something to give, but it you have to find what that thing is, right? Where you most shine.
And you don't know that too well before?
No, because when you come from the street, you feel like a failure, you feel like I can't do anything right, you have all these memories of shit you've done. The view you have of yourself are very small, and that has to be rebuilt, right? You have to get a new way of looking at things, you have to see your own worth, and for my sake, the house has been gold, because it has shown me I have potential that I didn't know about.
But this is so high tolerance and peer-led that it's special. Do you think this house will make some changes in the whole system? Will it do anything to other services?
Hope so.
You think so?
Yeah, we have NAV is the social services in Norway, and we already got meeting with them every 6 weeks. There we collect people from all the different welfare systems and people from the house, and we try to find new ways to help people without living accommodations or So we are already have begun, but it's a process, right? But the systems in Bergen and the politicians in Bergen have been great. I can't say any more than that. They've been very great. They have trusted that the visions we had is something they can see work in not only in theory but in the real world.
Så har jeg lyst til I dag å berømme huset og alt det arbeidet som legges ned der. Og kanskje det aller viktigste som man har fått til med huset, at man har ikke fått en plass i byen. Man har tatt den. Man har tatt den plassen. Med å være synlig, med å faktisk samarbeide både med kommunen, med næringsliv, med andre. Og det en så stor glede å se hvordan det å bli tatt imot i byen vår.
So this has been such a huge success. There's so many people here. The city just embrace you, the business people, the politicians. Why?
Everything is about relationships and whom you have a relation with. I just wanted them to listen. And how can I get these people to listen to the people who actually has lived experience and who is living in the experience, to change the O treatment, to get in the heroin clinic, to talk about amphetamine project and stuff.
If someone went to the business or to the politician and said, you know, we have been having user involvement for quite a while, right? And now we say we're going to lead this project. We need millions. And you said yes. And also to this night shelter.
Yeah.
And it's high tolerance. You don't ask people, do you use drugs? Have you quit? Do you have lived or living experience? It's new, that kind of tolerance. And now the user representatives gets trust, gets leadership, and meets at eye to eye on that level. How were you in a position to say, yeah, we will give you some millions for that?
Well, there's a lot of politicians, also politicians before me, have taken some chances. And I think we've seen in Norway that the way we've been handling drug issues hasn't been working. There's been a big national debate about the policy. There have been some changes, which is good, which is more like giving help instead of punishment, and that kind of shift, which goes quite slowly. But there's also been a shift in the municipality and how we work with these issues, because I think we see that we can't solve these problems on our own, and that we need to work together. And so far, it's really working, and letting the rest of the city know is also important, and how we're changing and working. And that's why I think the cooperation with the Chamber of Commerce is also really impressive.
Why is it important for you to be here and to include people with lived experience and so on?
Well, I think we are now in times where we do need all the resources in society basically to work, and we need the trust in each other. We need to be able to speak to each other, so it makes common economic sense. It also make less of a burden on budgets for the municipality here. The way that Huset here in Bergen manages to get people in and feel welcome, and companies here provide food and also basically real estate to help them do this. It gives so much back to the Bergen society, and it gives a lot of credibility back to the companies. So it's on every level, but most importantly on the human individual level. It makes so much sense to engage in this. And we are lucky here, I think, because in Bergen we have politicians, we have the Bergen Chamber of Commerce, we have also banks that are really supportive of this.
Huset Bergen, the house in Bergen, they managed to change the whole perspective, because we have a big problem in the town with people gathering, using drugs. And what's common and what we do every time with that problem is we chase people. Yeah, you can't be there, you can't be in the park.
You're not wanted.
What Marianne did and what the House of Bergen did was to change the whole idea that we can't have people coming together. Yes, we can. If we have an opportunity to get a nice meal, to meet other people, who cares? And I think the whole city saw that, like this conference team, that everybody can do a little bit. And I think that's why you see this huge engagement in the whole of Bergen around this initiative.
Now we're becoming more project leaders. We're running the system.
Yes.
We're equal on that level.
Exactly. That's some of the development I really welcome. There's a huge potential in this collaboration. The importance of the drug user perspective into how we develop our services and how we treat our patients are very important. We see the value of the perspective and the competence they bring to the table.
They're involved, they're committed, motivated to do a great job. They make things happen and had proven that they could get this done.
I don't like people either, I don't care who they are, to be dehumanized. So that is what's keeping me running. And as long as you see people as people, eye to eye, heart to heart, gut to gut, we can do this changing together.